TAVR, TAVR, stands for transcatheter aortic valve replacement. It's a minimally invasive way to replace the aortic valve, which is the main outlet valve of the left side of the heart, which pumps the high pressure red blood to most of the body. We recommend aortic valve replacement for people that have a very narrowed aortic valve called aortic stenosis, and that is leading to symptoms such as shortness of breath, chest pain, chest pressure, dizziness, these type of things.
Benefits of TAVR, I think, are the fact that it's minimally invasive. As opposed to an operation that would keep you in the hospital potentially up to a week. We've had patients out at times 1 day later.
I used to walk a lot every morning. I'd walk maybe for 45 minutes. We used to both walk together. But anyway, I noticed that, I think it was 2 years ago, I broke a bone in one foot. And so I had to quit walking for a while. So then when I started walking again, I noticed I was getting out of breath. But I just blamed it on the fact that I hadn't walked for about, for 2 months or whatever. But then after I walked a few weeks, I was still out of breath. So then that's when I decided I have another problem,
So Bud was a 97-year-old, a robust 97-year-old, but a robust 97-year-old still is a fairly frail person. So 20 years ago, with his disease, we wouldn't have been able to offer him a lot because he wouldn't have done well with an open heart surgery. But with this minimally invasive procedure, we were able to get him in, replace the valve, and let him go home the next day with his wife.
I breathe easier. I can walk further without running out of breath. I can walk stairways, which I do quite often, with more ease than I used to be able to. Well, I thank Dr. Gulliver and Dr. Snider for giving me part of my life back again, more like normal. They're both very nice guys.